O'clock now. My name's Louisa Wickham. I'm one of the organisers of today's event, and a very, very warm welcome to all of you to our first Diabetes Eye Day that we're running on behalf of Moorfields Eye Hospital. Why do we organise events like this? Well, they really do make a very big difference to our understanding of what it's like to have diabetes from a patient perspective. We also hope it gives you a chance as patients to tell us about what your experiences are and for us to get a better understanding of how we're doing for you. And we hope that today you will have a chance to talk to all of us and give us a little bit of insight into what it's like having diabetes, and so that we can all share experiences and hopefully learn from this. This is our first time that we've organised a Diabetes Eye Day, and so we're learning about this as much as you are. So any suggestions you have about how we might do this better or in future, we would very much like to hear from you. So please do come and talk to us about the day or throughout the day. Before we start today, I'm just going to go through a few housekeeping things for all of you. First thing is we're not expecting any fire drills today. So if the fire alarm goes, then please do assume that it is a proper fire drill. You will notice that there is a fire exit to this bottom corner down here. There's also a fire exit directly at the back of the hall, just as you're out through the double doors to your right. So should that happen, please use those evacuation points, and we'll of course help anybody who requires it. In terms of the programme today, as you see, we've got quite a packed programme of lots of very interesting talks. There have been a few changes, and just to let you know about them, Zara Chapman has very kindly stepped in to help us to talk about her work as a podiatrist and some of the aspects of that in diabetes. So thank you very much for coming at short notice. At midday, we've got Charles Karateng from the Redbridge Diabetes Centre, who's going to talk about smoking and the effects on diabetes. A few name changes on the programme as well. At 12:15, we have Pastor Stuart Morris, who's going to be talking about community, religion and cultural values in terms of its effect on diabetes. So that's a name change for you. And also, we've got Bashir Chowdhury, who's also going to talk about his work in the Muslim community. So there's a few changes for the programme. Throughout the day, what will happen is people will give their talks, and then we will give you plenty of opportunity at the end of the talk or after an end of group of talks for you to ask any questions that you might like to ask our speakers. We suggest that perhaps as you're listening to talks, if you think of a question, maybe just jot it down, and then at the end of the talk we will open up the floor to questions. Because we're trying to record the day, to record everyone's experiences as much as possible, we'd be really grateful if you could wait until the microphone reaches you before you ask your question, because actually the acoustics in the room can make it quite difficult for us to hear you on the stage. So if you could wait for the microphone, ask your question. We, as chairs on the front of the stage here, will repeat the question back to the speaker, not just so that we can actually again capture it for the video. So please feel that we're not sort of just parroting it. It's so that we can capture everything. So if we repeat it wrong in any way, do correct us. But that's why we're doing that. In terms of kind of housekeeping, in terms of rules of asking questions, if you wouldn't mind trying to make sure that only one of you speaks at a time, because again it's very difficult for us to try and field questions if they're all coming from different areas. So please do just wait for a second, and we will make sure that we get round to all of you. As well as the talks that you're going to hear today in the main hall, we've got a number of activities throughout the building. So as you will have probably seen as you all registered this morning in what's called the Smile Suite, you've got a number of posters there telling you a little bit about what we're doing at the hospital. There's also an opportunity for you, both patients and healthcare professionals, to vote on some of the issues around diabetes, and we would really value your feedback on those posters, and we hope to kind of collate them and do a little report about the day for you. We've also got a number of representatives from various organisations in the Smile Suite. So we've got people here today from Diabetes UK who will be happy to answer any questions that you may have. We've also got the Moorfields Eye Charity stand here today. It would be very kind if you could have a chat with Rob, who's manning that stand today. As you know, we have a lot of charitable fundraising that goes on throughout the hospital, so it'd be very kind if you have a chat to him as well. We've also got Katie Bunce, who's manning a stand on the research community. And she will be able basically to answer your questions about how you as patients might get involved in research. Maybe not necessarily taking part in a trial, but how you might maybe be involved in helping us as a patient representative, or allowing us to contact you to let you know about what's going on in the hospital. We've also got Professor Geoffrey Arden, who's also doing a stand on some of the research that he's doing at Moorfields, so I'm sure you'll find that very interesting as well. Upstairs we have the Voices for Vision room. This is essentially a diary room that's a video room where we will take the opportunity, if you'd like to join us, to do a little video capture of your experiences of having diabetes. And that may be as a diabetic patient or as a relative, family member, and also as a healthcare professional. You can go to the diary room with any kind of story you would like to tell, or if you don't have something specific you want to tell us, we have a number of general questions that we would quite like feedback on, just asking you about what it's like to have diabetes, how it's like coming to a clinic, those kind of things. So you'll notice that some of our medical students are going around with clipboards asking you to volunteer to come and see us, so you'll see them at the back there. So please, it would be, we'd love to hear what you have to say about diabetes, so there's that opportunity for you as well, and that's upstairs. And there is a lift to go up there should you have any mobility problems. Finally, we've got breaks at about 11:30. We'll be having coffee, and then again lunch will be in that main restaurant behind where you came in through for the registration. Once you've had lunch, please do go to the Smile Suite again. We'd love to talk to you there, and so most of us will sort of stand around there waiting once you've had some time to have some lunch and chat to you there. Helpers, as you'll notice, we've got very subtle green t-shirts on, so I think you probably won't miss us around today, but we're all here to help you answer questions, anything you might want to discuss with us. Look for a green t-shirt. Finally, in terms of ground rules, I think you've also got a sheet in your bags just saying a little bit about question asking, making sure that you wait for people to respond. Everyone here has volunteered to come here for the day, so please do bear that in mind if you get frustrated with anything during the day. It's the first time we've run this, but everyone here is trying their best and has volunteered to come on their Saturday to do this. Please turn off your mobiles, or at least put them to silent if you wouldn't mind, just so, particularly for the speakers, because it is a bit intrusive if they run while they are trying to speak. Now, before we start the main event of the talks, you will all have had a pre-event questionnaire placed in your bag, and we would be very grateful if we could just have you fill those out just for the next few minutes before we start our talks. And what we'll do is we'll ask our helpers to come and collect them from you. So I'll stop talking for now, and someone will come around and collect those from you before we start the talks.